everyone. Our sincere apologies for the delay in getting started. We experienced a slight technical difficulty, but my name is Bex Hayhoe. I'm the Director of United to End Homelessness, and I'm really excited to welcome you to the third in our community chat series. This has been a series of conversations that we've had in the month of June, specifically talking about homelessness, COVID-19, and how those two things have been impacted here in Orange County, California. Last week, we heard from Adam Nillison from the Orange County Housing Finance Trust and from Larry Haynes from Mercy House, and our conversation was around how to end homelessness during a pandemic. If you missed it, you can catch it on Facebook and on YouTube. It was a really great discussion and some really good news about progress that's being made here in our community to create more housing and get people off the streets and permanently housed to end their homelessness. But today, our conversation is shifting to the other end of that spectrum, to outreach, and I am thrilled to be joined by two amazing women who are just real leaders in this sphere. We've got Christina, who is from the Behavioral Health Service Navigation Program. I say from that, she's the administrative manager of that program. And we've got Jessica Bruce, who's the Chief Programs Manager for CityNet, talking about their work with regards to street outreach. So Jessica, Christina, welcome. Thank you so much for joining us. Can you first off start us by telling us a little bit about your outreach teams? What is an outreach team? What do they do? What does a day look like? And how did COVID impact the work of each of your teams? Excuse me.
Hi, Bex. Yes. So CityNet is a group of outreach workers who are case managers who go out in the community and engage homeless neighbors where they're at. We get them connected to resources, but our main objective is to get clients connected to housing, whether that be, short-term housing and emergency shelter, but really just getting them connected to the continuum of care so that they can work towards a long-term housing plan. With the COVID hitting in the last few months, it was really impactful on our work, and we knew that we needed to be out on the streets more than ever during this time to get our clients, to make sure our clients were safe, that they had the PPEs that were needed if they weren't going to go into projects. So we had to make a lot of adjustments in the way we did outreach. First was making our staff safe. So we were able to get all of the PPPs that we needed with masks and gloves. We created mobile hand washing stations in our vehicles and hand sanitizer and wipes. So really, getting all of those items together to make sure our staff was safe so they can go out in the field and help our neighbors during this time, and making sure that they were safe and they had the essential needs to be safe on the streets and in the community, or get them linked into the opportunities of Project Room Key in Orange County.
That's great. Thank you so much. Christina, how about you? What does your team do?
So for the healthcare agency, we have our behavioral health outreach and engagement team. And our focus has been to be in the community wherever the homeless congregate, to just work with them, get to know them, find out what their needs are, and then link them to needed services. Ultimately, we want to connect them with behavioral health services, but we realize to do that, we need to build trust and rapport with the community. We've been going out, as people know us as the blue shirts, but we go wherever the homeless congregate, and that can be at shelters, it can be for unsheltered environments. What we found really during COVID is that we needed to modify our services. One was to really educate our staff on prevention techniques, PPE, how to message to the clients, because what we really found is that they weren't getting information in a timely manner. So we were really their primary information source about what was going on, how to prevent, and really to dispel any myths. We also needed to modify our services to protect our own staff. It's interesting when you're in human services, how do you engage someone when you're social distancing? How do you get consent signed? How do you connect them to a program that's only doing things telephonically before we would really thrive on making those connections through a warm handoff and being with them during the journey. Now we're all doing it through the telephone or connecting them to their service provider initially through the phone, or having to adjust and find out how do you access services if that office is closed or if that organization is closed. So we found we had to pivot a lot in order to connect folks. We just had to be creative and flexible. And then we also found that we had folks with new behavioral health symptoms, folks that were experiencing anxiety and stress and needing to utilize coping skills that they had never had before, all among being socially isolated. And so if you didn't have that phone, and often they're not smartphones, then you weren't feeling connected to the community. So needing to adjust in that way and talk about coping skills, talk about social isolation, and try to really encourage folks to feel connected in different ways. In addition to connecting with Project Room Key, that was something else we've been doing.
That's great. Thank you so much. It's really interesting to hear kind of how each of your teams had to adapt. And I know that for most of us, we experienced a level of anxiety with COVID-19. And so thank you for sharing some insights for how that's been for our neighbors who are experiencing homelessness. I read a study by a professor of economics at Columbia University, and he stated that they thought that there would be a 40 to 45% increase in the next year or so because of COVID's impact on the economy, that would increase homelessness by 40 to 45%. I'm curious, has anybody from either of your teams actually run into anybody that has become homeless because of the impact of COVID-19?
Oops.
There we go. CityNet has seen an increase of families that were one paycheck away from homelessness, experiencing homelessness now. So we've had a lot of families that were able to self-sustain in motels or different living situations, rooms for rent. But around the middle of April, we saw an increase received an increase of calls of families that were no longer able to pay for their motels or rooms for rent. So they were now in their cars. So in the last 3 months, we've had an increase of 40% of families that we're serving, trying to get them connected to a safe living situation while we work with the shelter system to get them into a shelter opportunity. On the single side, we continue to see an increase in our single side, but I feel at this time so far, we've really seen an increase within our family population on the streets.
We've also seen an increase, but I think it sounds like less of an impact than what CityNet is experiencing, but we are experiencing more individuals that this is their first time with homelessness. And so they're not really sure what resources are available and maybe don't have the same, I guess, life skill set that some of our chronically homeless have developed. And so they're newly homeless. Most of them, as Jessica mentioned, were folks that said that they were renting a room, and either because of job loss or because maybe someone in that household was vulnerable, so they no longer wanted to rent to somebody. They really, their renter wanted to, or their landlord wanted to kind of minimize their exposure, and so stopped renting to them. Or there was someone vulnerable in the household, so they left the household, were renting like motel stays, and then could no longer afford it. So we're definitely experiencing, I think, changes in the population. We're getting more calls on our triage line for looking for rental assistance or for planning for homelessness, because they're kind of on the verge of being homeless or experiencing homelessness.
Well, thank you both for those insights. I think that there's a lot of things that you referenced that are happening that many members of our community may not be aware of, and how COVID has been impacting people. Both of you mentioned earlier that part of your roles is to connect people with Project Room Key. Could you just share a little bit about what that looks like? What's the process? What's the flow?
Yeah, so when the county first started Project Room Key, our case managers sat down and looked at all the clients that we're serving in all the different cities throughout Orange County. And we prioritized our seniors and the ones that we knew of underlying health conditions to get into Project Room Key. And since then, we are working with the county. The county has the referral line, so the people are calling the county, and then they're sending the referrals to CityNet, and we are following up with clients and getting them connected to Project Room Key. It's been a great collaborative efforts between the county and Illumination Foundation and Healthcare Agency and CityNet to work together to try to get as many clients as we can into the project to keep them safe during this time.
Yeah, and we've had a similar experience. We went through folks that we knew should fit in that vulnerable population category, as well as our folks that might be age appropriate to be referred into Project Room Key, and then have really been open and amiable to those also experiencing symptoms to be able to be referred in. So we did the same thing, looked at folks that we knew that we wanted to connect with, really went out to engage them. I think a big fear of folks was, if I go into this location, again, being isolated. So one of the things that we've done for behavioral health is reach out to those folks, regularly connect with them. If we know that they have a behavioral health need, then we're following up to do assessments, to just check on what their areas of need are, and then also just to call so that they're not feeling as isolated. Ultimately, we want to connect them to supportive services or the appropriate behavioral health program. But what we're finding is right now they just may need daily check-in because of the isolation.
Great, thank you for that information. We asked people to submit their questions in advance, and one of the questions that we saw repeated was, how can people help right now? So we have a lot of members of our community who are just compassionate, who want to be involved. What would each of you advise? How can they help people who are currently experiencing homelessness? Is there anything they can do to help either of your organizations as well?
Yes, we're, prior, we didn't see as much food insecurity in Orange County because we had so many great, community members out feeding and doing things for our homeless neighbors. But since COVID has hit, people are safe, they're staying home, and we want them to do that, but our homeless neighbors are struggling with food. So gift cards, $5 and $10 gift cards to different food, restaurants would be a great help. So our case managers can use that as a tool to engage homeless neighbors and build that rapport, and also get them a hot meal so that they, are not hungry at night. So that's one of the areas that we've never really struggled with in street outreach, because there's always been so much community help with food. But at this time, we're having a large increase of requests for like, hey, can you help out with a meal today? Or do you have any snack packs? So snack packs and those $5 and $10 gift cards to local restaurants are very helpful when we're out and meeting up with our clients.
I agree. We've been seeing food insecurity as well, and really a lack of ability to for basic hygiene. So providing hygiene items, a lot of programs that we're providing to this population may not be available, or their resources are running low. So not just food, but also hygiene items. As businesses open, we look forward to having more access to hand washing and just restroom facilities, because that was definitely a challenge as everything was closed or shut down for our population to even be able to access appropriate facilities. So we hope that as businesses open, that they are allowing our population to utilize their facilities again. And even if that's to be, some type of respite, we used to have a lot of folks that would access, public buildings to charge their phones or to just kind of get out of the element. So we're looking forward to that. And that's one way the community can help. I think also accurately sharing information, going back to if our folks aren't getting information firsthand, like somebody who is housed, where they go home and they watch, a news channel or a report, or you watch that on your smartphone. If our folks don't have internet connections, they don't have that kind of connection to the community, then they're not getting accurate information. So sharing accurate information with our population, and then also just extending that continued empathy and patience. We're all going through a lot. I know that the line that we're all in this together, but just reminding us that, because I think that these times are very trying and challenging for everyone, and we've been enduring for quite some time, and it's getting a little harder, I think, for folks to deal with the daily challenges. So just being human, connecting in ways that you can, because you can't even see a smile anymore with your mask on. So somehow connecting with the population, acknowledging them, keeping them informed, and then of course donating, exercising patience and empathy are all things that would really help us.
Well, thank you both so much for your insights and for shedding light about how street outreach is working and how members of our community can help. This does bring us to the end of our time together. That felt really fast, and I feel like we could have talked about a lot more, and covered a lot more ground. But just a huge thank you to each of you for sharing from your vantage point what's happening and how we can each be involved in helping. So next week, Thursday at noon, is our final community chat series for June. We're contemplating keeping these going, but this is the next one we've got scheduled, and it's specifically about CARES funding. And we're delighted that we're going to be joined by U.S. Representative Mike Levin for California's 49th Congressional District and Assemblywoman Sharon Quirk-Silver for District 65. So we'll be talking about the funding that's coming down the pipeline. So if you haven't RSVP'd yet, I encourage you to do so on Eventbrite and send us your questions so we can put those to them. So again, a huge thank you, Christina and Jessica, and thank you to everybody who tuned in. We'll see you next week.